Hi guys, I'm Dr. Alex Pastuszak and I'm a urologist at the University of Utah who focuses on men's health in both my clinical practice and my research. I wanted to take a minute to talk to you about testosterone since it's Men's Health Month and it's really important. And also you hear a lot about it these days. So let's set the record straight on a few things. We're going to talk about the following: testosterone levels over time in men, how you diagnose low testosterone, which is also called hypogonadism, treatment options for low testosterone, for questions about fertility and low testosterone, cardiovascular health and testosterone, and finally prostate cancer and testosterone. These are all burning things that people want to know about. So first, let's talk about testosterone levels over time. In most men, testosterone levels start to decline by about 1% per year starting at about age 30. While most men don't really notice this at first, over the years, they can start to feel the effects of this drop. So what does this feel like, and how do you diagnose low testosterone, which is also called hypogonadism? So most often guys will complain about feeling tired, quote unquote slowing down, having a lower sex drive, and sometimes they'll complain of worse erections or erectile dysfunction. These symptoms are important but not specific, as you can imagine, and only with a blood test to confirm low testosterone levels can you really make a diagnosis of actual hypogonadism, which is what this constellation of symptoms and low blood testosterone levels is called. So, what can guys do about it? There are a number of treatments ranging from testosterone to other drugs that are less hurtful to your fertility. Bottom line, you should know that there are options and have a discussion with your doctor about the right regimen for you based on your individualized goals. So, circling back to fertility and testosterone, while testosterone that's made by your body is really important to your ability to make good sperm, taking testosterone will actually shut that system down and can make you infertile. There are a few other treatments like HCG and a drug called Clomid, which comes in a pill, which can help your body make more of its own testosterone, but that won't actually shut down your testicles and make you infertile. If you're young and thinking about having kids, then this is definitely something you should discuss with your doctor. So let's switch gears a little bit now and talk for a minute about cardiovascular health and testosterone. There's been some research over the past few years that suggested that men on testosterone have an increased risk of heart attacks. However, ultimately the jury is still out on this and more work needs to be done. What we may have better evidence for, though, is that low testosterone levels can actually increase the risk of heart attacks. So it may be better to treat those low levels than to avoid treatment. However, only time will tell. Finally, let's talk about prostate cancer and testosterone. So we know that prostate cancer cells can grow in a test tube in the presence of testosterone. However, they really only grow when they have very little testosterone around them and are then exposed to testosterone. And often they stop growing above a certain level of testosterone. Similarly, in men treated for prostate cancer using radiation or surgery, small studies have shown no increased risk of prostate cancer progression or recurrence in those men after they get put on testosterone. And the evidence is actually even similar in men with active, untreated prostate cancer. So while I'm not saying that it's completely safe to give a man with prostate cancer or after treatment for prostate cancer testosterone, there's good evidence that shows that men aren't going to be hurt by it in the near future. So hopefully these little tidbits give you some information that you can think about. Bottom line, though, is if you are having symptoms of hypogonadism, you should go get checked out and ultimately treated. It can absolutely change your life. So take care, everyone, and feel free to reach out to us with questions.